Hi, Dr. Fleetwood. How are you?
I'm doing well, Ben. How are you?
Well, thank you. So I'm Dr. Ben Reeves, and I'm a professional associate with the Naturopathic Medicine Institute, working toward my Vitalist Fellow Track certification. And the Naturopathic Medicine Institute envisions a world where enjoying optimal health allows people to reach their highest potential for inspired creativity. And it asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And today, we are joined by Dr. Christie Fleetwood. And Dr. Fleetwood, would you please tell us a little bit about yourself?
Sure. I call myself medically bilingual because I've been a pharmacist since the late 80s and a naturopathic physician since early 2000s. So if you combine both of my professions, I have over 40 years worth of medical experience. So I bring a different perspective when I talk about pharmacy and pharmacology issues.
Great. Well, thank you for that. So my understanding is that you want to talk a little bit today about comparing and contrasting working in an unlicensed state as a naturopathic doctor.
Correct. One of the things that I love about the Naturopathic Medicine Institute is its goal to educate the public on how we are so very different from conventional doctors. And it's such a huge need. And also, the Naturopathic Medicine Institute is bringing back vitalistic thinking into the naturopathic profession as a whole, which is hugely important. When I graduated, like immediately after I graduated from Bastyr in 2004, I hopped in the car. No, I took my licensing exams first. And then I hopped in the car and drove across the country to go back home to unlicensed Virginia. Because my mom was dying, my family was there, I had 2 small kids, etc. In an unlicensed state, you can't do high-level interventions. And really what I did was just hang out on the lower 2, maybe 3 floors of the Naturopathic Therapeutic Order, teaching people how to eat real food and drink clean water and get to bed on time and have healthier relationships. Just simple, common sense, basic types of things. And I was called a miracle worker and a godsend and a wizard. Just from teaching people how to eat food. And there were the occasional supplements employed. But honestly, I got to watch for 8 years, being in unlicensed Virginia, my clients reversing their disease process. It wasn't chronic disease management, it was reversal of disease. The typical run-of-the-mill things like high blood pressure and high cholesterol levels and type 2 diabetes, and then the more difficult cases like rheumatoid arthritis and multiple sclerosis and Crohn's disease and Hashimoto's hypothyroidism and lupus. And after 8 years of being the miracle worker, all I was doing was providing some information and education, and my clients did all the work. But then we moved back to broad scope licensed Washington State. And I was told by so many people that I could not reproduce what I had done in Virginia, which started off just being me hanging a shingle and ended up with 7 complementary and alternative medical practitioners in one building, 3 naturopaths and many others. I was told that I couldn't do that in a licensed state because here we're primary care providers. Here, insurance covers us. Here we have a well-known, world-renowned naturopathic medical school. But honestly, people don't know who we are. They don't know how we're trained. It doesn't matter that Bastyr University is right down the road from me. People in Kenmore have never heard of it. Even the people who come to the grounds to go hiking in the trails year after year or go to an event that Bastyr puts on, they don't necessarily know that we're training doctors there. So after having worked in a group naturopathic practice for 2 years under contract, fabulous people that I love and respect, but working for an insurance company or a handful of insurance companies, the dynamic between doctor and patient changes dramatically. If you're going to make money in the insurance model where we don't have insurance parity, meaning medical doctors and naturopathic doctors do not make the same amount of money for the same codes, you end up having to kind of push through the patients kind of fast so that you can see more and more people in order to bill more and more insurance companies to get a little bit of money. You have to have 50 patients that you're seeing each week in order to make a reasonable income here. And then because you're in the confines of the insurance construct, you begin to, well, you got time pressures. You can't hear the story and get to know the patient. You end up pulling out what's going to be fast. And unfortunately, that's too often a prescription blank. And we're writing for a pharmaceutical, which isn't really naturopathic medicine. So, yay! The Naturopathic Medicine Institute has come along and started talking about how we can remember our vitalistic principles and roots and go back to the practice and art and philosophy of our naturopathic medicine, slowing down, going back to the basics, teaching people how to eat real food, drink clean water, think healthy thoughts, be in healthy relationships, get reasonable sleep, move your body. And now I'm seeing the magic happen again with my patients here because I no longer work for their insurance companies. I do a house call membership model, and I'm loving this again.
That's great, Dr. Fleetwood.
There you have it. I've summed it all up.
Dr. Fleetwood, for those who don't know, could you just tell us what the first couple levels of the therapeutic order are that you referred to?
Absolutely. The first level is remove the obstacles to cure. Very often it's our own hectic lifestyle. So having people prioritize what is really important for them and then showing them that the way they're living doesn't quite line up with what they say is the most important. So then they either decide that the way they're living is more important, or they change the way they're living to match what they say is the most important. Then the second level is stimulating the vis. This is the thing that sets us most apart from other healing paradigms, is that we believe that there is the inherent capacity within to heal ourselves. You cut your finger and it heals. You sprain your ankle and it heals. We're designed for health. We're created to be healthy individuals. So, and I think another piece of stimulating the vis is engaging the patient in his or her own healing journey. There's something to be learned about dis-ease. So getting people, they come in with a chief complaint. Hey, my knee hurts. Let's be curious. Why does your knee hurt? Why does your knee hurt now? What's been going on? Maybe it's how the person sits at work. Maybe it's how they run when playing. Maybe it has something to do with the first chakra and they've got mental, emotional ties to family or finances. But wrapping in that whole person, mind, body, emotions, spirit, and looking at the lifestyle, this is getting your patient to buy in to what your homework is going to look like. There are multiple things in which we're trained. I could offer a botanical, a homeopathic, some physical medicine, some nutritional counseling, some lifestyle counseling, but what is it that my patient would be most open to? That's where we need to begin. So getting the patient to actively participate in his healing is really important. So those are steps 1 and 2. Step 3, I think, is strengthening weakened systems. So if I have somebody who has high blood pressure, for example, that lets me know that there's a weakness in the circulatory system, in the cardiovascular system. And so where do we need to look? And again, looking at mind, body, emotion, spirit, this might be that the vasculature is inflamed, that we have endothelial cells that they're inflamed, or that the elasticity has been reduced over time as we get older. Or it could be that we just got somebody that's hard-hearted in the office, because symbolically, the words that a person uses tell me an awful lot of where the true etiology of disease begins. So those are my favorite steps. Steps 1, 2, and 3.
Dr. Fleetwood, how do you go about getting someone to buy in to a treatment or a plan?
Right. I ask. I'll say, I've got a whole bunch of ideas coming to my head, and it's going to any of these would work well for you. The more you employ, the faster you're going to heal and the better you're going to feel. But what are you interested in doing? And so with my very first office visit, I have a 12 bullet point, 1 piece of paper handout called Naturopathic Basics. And it's really basic: how to eat clean food, drink real water, those things again. And I'll just hand that to my patient and say, which of these makes the most sense to you? Which are you willing to do? And that's where we begin. And I'll circle 3 or 4, or have the patient circle 3 or 4 that they will commit to over the next 4 to 6 weeks until we see each other again. But they have the next steps already there. If they get those done, great. Add on a few more, because you're going to feel better with just those first few that you pick. And then once you've got those kind of tucked under your belt, so to speak, then you've got the next ones to make yourself feel even better. It's great fun.
Dr. Fleetwood, how did you get involved with the Naturopathic Medicine Institute?
Oh, right. How did I get involved? Well, several things. One was Dr. Eli Camp had asked me to do some continuing education for her Medicine Talk Pro. This was after okay, so here's the real story. This is after she came to do her business presentation at Bastyr University. And I went to her business program. We're about the same age. We graduated about the same time. We have a lot of things in common. So we went out as a large group for dinner. The next night, I had her just come over to my house, and we had dinner here. And we had a long, really good talk about the direction that naturopathic medicine seems to be going. And she said to me, call Jim Sensenig. You need to talk to Jim Sensenig. And just let him know your ideas, because I had this, I thought, masterful idea of starting, I've been calling it a halfway house for new graduates, meaning as new doctors were being graduated from Bastyr, if they wanted to come and work with me, I would have a clinic where I'd have brand new grads come in and learn how to run business from the ground up and be the mentor for them. I've only been out 13 years, but like I said to start, I've got over 40 years of experience in the medical field with my combined degrees. So I love to teach. I love patient care. I love dealing with the students. So I figured I would just mentor them in their first few years. And when they were ready to leave, instead of being territorial, would have a big party and invite the patients of that doctor who was about to leave, make sure that business cards and brochures and addresses and everything are ready, and just love on that new doc as the doc, well, now doctor's been out for 2 or 3 years and ready to go hang her own shingle, and take her client base with her. Unless, of course, she's traveling across the globe. So just making it celebratory and becoming the hub in a given community for the first stop, anything that you need to know about health or wellness or disease or prevention, have people come to us first, offering community education bits, offering movies to watch, and having a panel discussion afterwards. Anyway, I think it would be fabulous, but it's never worked out. And I've wondered, why isn't my fabulous plan working out? And I think that with the Naturopathic Medicine Institute, it is about to come true. So I'm very excited. I'm so excited. Like that first Vital Gathering, the best naturopathic conference ever. So looking forward to October.
That was so awesome.
It was so
well,
good.
We're coming up on, I want to be respectful of your time, Dr. Fleetwood.
Mm-hmm.
Is there anything else you want to share today? We've got another minute or two, and we can kind of close this out. Anything else you wanted to say?
Students, if you're interested, please join as an associate. I think it's the whopping annual fee of $25. Practitioners, those of you out for 10, 15 years, if you want to come back home to your naturopathic roots and love this practice, this art again, join us. It's so worth it. And join us in October because, wow, I'm not sure what more to say. It blew my mind, and I think I'm pretty vitalistic in my thinking. But to hang out with the elders, Jim Sensenig, Jared Zeff, Tom Cruzel, Charlie Cropley, Louise Edwards, Tish Dick Cronenberg. I love these people, and to be surrounded by them, wow, to have conversations with them, to learn from them, and we're going to be able to learn with the students all at the same time, all at the same level, learn the different modalities and the thought processes behind them that are on the verge of being lost. So if you want to hold on to the magic, come be a part of the fun. It's great fun.
Well, thank you so much for taking the time today, Dr. Fleetwood. And
Absolutely.
everyone, visit naturopathicmedicineinstitute.org to sign up, learn more, follow us, check out events and upcoming CE and so on. And the NMI, or the Naturopathic Medicine Institute, the laws of cure are seen to be immutable, and the healing power of nature is acknowledged, discussed, unpacked, and celebrated. Thank you.
Thank you, Dr. Reeves.
Thank you, Dr. Fleetwood.